This sound means relief for Valerie Walker. Oxygen is giving her a drug-free way of cutting the length of a cluster headache, which can last anywhere from 15 minutes to 3 hours, several times a day.
Cluster headache for me is on one side of the head, and it's usually a very piercing, stabbing pain in the eye area.
Our study showed for the first time a clear difference between oxygen and air in the treatment of acute cluster headache. It was properly powered, randomised and placebo-controlled, and really provides evidence for the use of oxygen in cluster headache.
Dr. Peter Goadsby from the University of California, San Francisco, and fellow international co-authors followed 76 patients in London, England from 2002 to 2007, treating 4 cluster headaches in each patient using air and oxygen. The study is featured this week in JAMA, the Journal of the American Medical Association, and found patients using the oxygen were most likely pain-free after 15 minutes of treatment.
20% of attacks were improved on placebo, that is on air, and 78% of attacks were improved on oxygen. A clear difference in favour of oxygen.
It means the difference between being in pain for most of the day for me instead of just being in pain for short bouts throughout the day.
This study is important because it offers patients with cluster headache a safe, effective treatment that they can use on multiple occasions that will give them good pain relief for their appalling headaches.
Catherine Dolph, The JAMA Report.
An important finding from our study from a patient point of view is that oxygen is effective because oxygen can be used multiple times during the day. Unfortunately, other treatments of acute cluster headache are limited in the number of times you can use them. I've spoken to cluster headache patients who've had gunshot wounds and knife wounds and peritonitis and chest pain, and I've spoken to pregnant ladies who've delivered babies, and none of that eclipses an acute cluster headache. There were 2 things I found very interesting about the study. One is the ability of oxygen to work quickly and effectively, and the other linked to that is the ability of oxygen not only to stop the pain but also turn off the other symptoms of the attack, the eye watering and redness.
If a sharp object like a pencil were shoved into the eye socket area and like fragments of a pencil were coming off in the areas around the eye, it kind of comes down around the eye area, and sometimes the pain goes down towards my upper jaw and off towards the ear. It's a very intense pain. The pain drives me crazy. I cannot hold still. I want to go pace or rock, or it just is incredible the amount of pain I experience. When I got cluster headaches, I was working full-time and going to school full-time, and I am no longer in school right now. I've just been laid off from my job. It's impacted my relationship a lot. I haven't had the time to do a lot of the things that I've wanted to do. Oxygen has just made all the difference for me. I do not have the side effects, and it has made all the difference for me. About 15-20 minutes. It's still the best abortive for my headaches.
What rate do you use the oxygen at?
15 liters per minute still.
And what sort of mask rate do you use the oxygen at?
15 liters per minute.
Then what sort of mask are you using?
The non-rebreather mask.
Do you find that useful?
Very much so.
Are you part of OUCH?
Yes, since April.
How many people are there in it?
Group online has pretty much broken up.
Why?
They had some web space, or I don't know how you refer to the
Our website, yeah.
yeah.
Put it